Experimenting with drugs and alcohol is nothing new. It's been happening for years. Oftentimes, it begins as children become teenagers. As the parent of a teenager, recognizing your child may have a serious problem with drugs and alcohol can be scary and even unfamiliar territory. It's important for parents to be educated, communicate with your children, pay attention to their behaviors and habits, support your teens, and learn to recognize the warning signs of drug and alcohol abuse. Acknowledge any suspicions and make the necessary decision to seek help. Where do you start? At Chestnut Health Systems, we can help. The first step is education. Educate yourself. Be sure you know what you're talking about. Teenagers know when you're misinformed. The more you know, the more credible you are. Develop open communications with your children. When speaking about sensitive issues, keep a few things in mind. Keep your conversations private, and when you see a teachable moment, teach. Sometimes life unexpectedly opens the door to conversations, whether it's a movie star, professional athlete, or even a family friend who has been affected by the use of drugs and alcohol. Taking time out to communicate with your teen can make a lasting impression. Help your teen make positive choices by setting a good example. Practice what you preach. Don't reach for a drink after a bad day. Always use a designated driver, and be sure you are responsible with medications, both prescription and over-the-counter. Encourage your teen to get involved in and out of school. Team sports, special interest clubs, and activities provide camaraderie, interaction, and even guidance by a coach or leader. Build your teen's self-esteem. Support their efforts and be their biggest cheerleader. Stay involved and in tune with their surroundings. Set boundaries for your teen and follow through on the consequences for not staying within those boundaries. Praise them when they respect their boundaries. Recognizing the warning signs of drug and alcohol use might be difficult. At Chestnut Health Systems, we have developed some simple tips to help you. Notice declining grades, increased absences, or even an overall negative attitude towards school? Is there an increase in the secrecy surrounding activities, whereabouts, and even personal possessions? Is your teen hiding chemical odor by using increased amounts of incense, perfume, and air fresheners? Have you noticed an increase in the frequency and amount of money being borrowed? Or have you stumbled upon evidence of drug paraphernalia like pipes and rolling papers? Have you found evidence of inhalant usage and accessories like hairspray, canned air, nail polish, paper bags, and rags? Or just an overall change in your child's attitude or physical appearance? All these might be warning signs of drug and alcohol use. Now that you know some of the warning signs, what do you do if you suspect your teen might be using drugs and/or alcohol? Start by sharing your concerns with your teen, but avoid accusations. Be firm, yet loving. Enforce discipline for breaking the rules and making poor decisions. Continue talking openly with your teen, providing specific examples on ways to avoid using drugs and alcohol. If peer pressure is an issue, teach them how to say no and walk away. Guide them on what to do and how to react in an uncomfortable situation. Determining the source or cause of drug and alcohol use is difficult too. Once you determine there is a serious issue, you'll need to decide if counseling is appropriate. If your teen needs substance abuse treatment but resists, try having someone your teen trusts and respects talk to him or her. If a therapist is necessary, start by seeking guidance from school counselors, physicians, or even close friends. At Chestnut Health Systems, we can help. Our staff is dedicated to making a difference. We're here for you every step of the way. For information about our services, call us toll-free at 888-924-3786 or visit our website at www.chestnut.org.